What's up, guys? Welcome to another question of the day. Today is not really going to be a question. Today is a topic that I want to talk about, and that is about surgical versus non-surgical facial procedures. I get asked a lot about filler in the face and correcting certain things because a lot of patients want to avoid having surgery. And I think that it's great to exhaust non-surgical options first. There are a lot of things that you can do. You guys follow me as a plastic surgeon, which means you probably follow other people. So you're well aware of filler and all of those things that are out there. So I don't really need to talk about that. What I really want to talk about today is the whole process of using filler. And when you come to see Skylar, my Nurse Injector, at AZ Nurse Injector to get evaluated, I want to talk about what's going to happen at that visit. At that visit, she is going to look at your face and evaluate what she thinks you need. She's going to look and talk about the concerns that you're coming to her for. Do you need volume in the mid-face? Do you have tear trough formations where maybe you need some filler there? Do you need some filler in the folds? So let's talk about that process, because a lot of people get really bent out of shape when they get a quote for $4,000 or $2,000 or whatever it costs to put filler in the face. And I want to talk about that process and tell you about how it works. What you need to understand is she is going to recommend full correction. She's going to recommend what you need, and I do the same thing to patients that come to me to talk about facial procedures with filler. We're going to recommend full correction. For a lot of people, that means 4, 5, or 6 syringes of filler to get you where you need to be. What she's going to do is draft up a plan for you, and what I want you to understand is this. There is an upfront investment in this process. That doesn't mean that you're going to have to spend that kind of money all year long. What it means is to get you where you need to be, you need X amount of volume added back to your face. Once you are happy and she's happy with the way that things look, the likelihood is you're only going to need 1, maybe 2 times a year to come in and get 1, maybe 2 syringes to put filler back in your face to maintain what you've done. So my point of the discussion today is I want you to understand that there's an upfront investment to get you where you need to be. To do anything less than that is just silly. You may as well put your money in the trash can. The goal is to get the correction that you desire, and sometimes we're wrong. You needed more than we thought, or you needed less than we thought, in which case it could be more expensive or less expensive. I personally, she's worked on putting a little bit of filler in my mid-face to support my mid-face because my nasolabial folds have started to sort of show a little more with my mid-face descent, and over time, very slowly, she's put several syringes of filler into my face to support my face. Now, it's been over 6 months since I've had filler, and now I probably will need once a year maybe to have a little filler put in to touch up those areas or to maintain what I've had. So the point of my post today is I want you guys to understand that once you make a plan, yes, there's an upfront cost. Don't feel like that cost is what it's going to be every time you come in to get a treatment. All it means is that's what it's going to take to get you full correction, and then beyond that, it's just maintenance therapy with a dose or 2 here and there. So I hope that gives you guys a lot of information and it helps you. Again, if you have a question, you can ask it because you know I'll answer it. Have a great day.